We know what suffering from BPH is like. It affects your daily life, forces you to make compromises. Ultimately, it impacts how you feel about yourself, your confidence, your manhood. And we know searching for relief probably feels like a roller coaster ride of frustrations. Well, there's hope. BPH no longer has to stop you from being you, the whole you. This is where Aquablation Therapy comes in. It's a unique surgical treatment for BPH. It gets you back to being, expressing, and living like the man you are, without compromising yourself to get there. Speaking of compromising, you shouldn't have to. Here's why. There are two types of surgical procedures for BPH: non-resective and resective. Non-resective procedures don't involve removing any prostate tissue. Sure, you'll probably preserve sexual function and get some symptom relief, but it may only be a temporary fix. What can you do? Prostates just like to keep growing. So you may be back for another procedure. Now let's talk about resective procedures. There are a lot of options out there. All of them involve removing some or most of your prostate tissue. You'll be happy to hear you'll get better and longer-lasting symptom relief, but these procedures have high rates of irreversible complications, things like incontinence, erectile dysfunction, and ejaculatory dysfunction. Seems unfair to have to choose between getting really good long-term symptom relief or avoiding permanent impact to your continence or sexual function, doesn't it? Well, that's why Aquablation Therapy was developed. It's BPH relief without compromise. It's not just for your prostate, it's for the whole you. So, what makes the procedure so unique? Aquablation Therapy is the only BPH treatment that uses two forms of imaging simultaneously, giving your surgeon the ability to see your entire prostate in real time. Using this complete image, a customized map of your prostate is created. This lets your surgeon plan exactly which tissue to remove and which to avoid. Then it gets pretty cool. Actually, it's a shame you'll be asleep. A robotically controlled heat-free waterjet follows your personalized map, removing prostate tissue with pinpoint precision. The results? Long-term relief because tissue is removed, and low rates of irreversible complications because of the imaging, robotic technology, and heat-free waterjet. In other words, you get BPH relief without compromise. That's it in a nutshell. And here's the good part. Most patients end up leaving the hospital the next day without a catheter. So that's how Aquablation Therapy works. And speaking of works, the numbers don't lie. In clinical studies, 100% of men maintained erectile function, 99% won't end up with incontinence, and nearly all men preserved ejaculatory function. See for yourself. Visit aquablation.com to learn more and hear from men like you who've chosen Aquablation Therapy. We hope this video gets you excited and ready to talk to your doctor to determine if Aquablation Therapy is right for you. Start exploring the possibilities of a BPH treatment that's not just for your prostate, but for getting back to being, living, and feeling like yourself. Aquablation Therapy.